My name is Angelica Jacquella, and I'm a human earth angel. I'm a humanitarian, act in the best interest of humans, babies, kids, toddlers, humans of all ages, all living creatures and nature. I have a message for all women, and the fathers included, to consider this information, to please hear it and share it to all those who need it, to prevent their health from failing, and to prevent an innocent life of an infant baby in the womb and after born when the mother is breastfeeding from being their little life brain organs harmed, their health, what they don't deserve, and no human has a right to harm an innocent infant life, which has a dignity of God to be respected by their parents, the mother, especially, to remember to be well rested and to take care of their health if they didn't supposed to all their life. Eat proper nutritious food, rich in nutrients, vitamins, proper minerals, proteins, healthy fats, proper amount of blood sugar, with healthy immune systems, healthy brain, to be of sound mind, intelligent, of clean-minded morals and etiquette, respecting their health in all ways and that of others, that have clearly planned ahead for years and throughout their life planning to have a child and respected their own health and planned ahead to look up online recent research done and through the years of which foods for the father and the mother to avoid so that their health is proper physically, so that they have proper genetic makeup and be compatible as a couple to have a healthy infant, a baby, a little human life with a brain, organs, physicality, body that needs to have enough nutrients, proteins, have a number of proper vitamins, minerals to form all different types of new organs, cells, the brain, and all other parts of the little physicality of the baby infant in the womb. And as humans know, there are many things and online that can be looked up. Credible research has been done. There are certain food items, even well-known vegetables and fruits, that certain items by a human being, the mother especially and father, to be avoided throughout their life if they're thinking of even going to have an infant, to leave out these certain vegetables, rather fruits, certain foods, to leave out caffeine entirely, that certain items such as alcohol as well damage stomach lining, harm the brain, physical organs, and other harmful substances, including humans Unfortunately, most are misinformed by doctors of psychiatry, certain medical doctors. This is very beyond wrong and disrespectful of a human life and health, a dignity of God everyone has as a valuable life to be respected by others, especially those working in the department of psychiatry, medical doctors, other staff, nursing staff, to be aware, general practitioners, which are doctors practicing various different fields of medicine, certain specialists. There are a lot of medical staff that swear an oath to God because their studies, what they studied and for long years invested in, were geared towards respecting the health and lives of their potential patients. Live humans, patients that have a life, a soul, brain, organs, many physiological functions that have to be, and emotions, a soul to be respected on this earth by them being educated and to look up online to keep in mind most up-to-date research to do in their job description best they can to assess the physical and mental brain health of a human being and to find in proper timing anyone else, a specialist further who can, to prevent the health failing of and or stop the health failing of an individual, a human being, to provide proper medical advice. Doctors of psychiatry all know what medical doctors know. Study mental health, which affects the brain, and physical health. These humans, by law and under God, are asked when about to be employed. Are you going to respect your patients if I hire you in the way in your job description you have studied? Are you going to respect other humans? To keep in mind, these patients you're going to deal with are humans at every age in your specialized specialty of medicine that have chosen to practice in, including the department of doctor of psychiatry, medical doctor, general practitioner. Are you going to assess to the best of your reasoning ability the health properly of another human being with the intent of caring and respecting their health and lives and dignity and free will of choice, to assess their health, brain, mental, physical health properly in proper timing, to prevent them from suffering, to provide proper advice as a doctor of psychiatry, a specialist in every field, that your job is trained, that you are trained in your job description rather to do. Are you going to consider that this human has a valuable life and worth respecting dignity of God, human and religious or not, of every gender, race, humans? You're going to consider that a human has human rights, to respect bioethics laws, to not consider patients against free will for the purpose of research? Are you with the intent of only by law and under God, are you going to do everything that you were trained and studied for in your job description that it entails to respect another human being and their health and life? Provide proper counseling if needed, medical advice, depending on your area of expertise, specialty. Are you going to respect others as you want to be treated with respect in all these ways? Respect their patient rights by law and under God. And then if the doctor agrees, potential one, doctor of psychiatry, specialist, other ones, neurosurgeons, geriatric care, other ones dealing with children. In this video stating about of the parents to assess not only the mother but the father, their health properly, physical health, their emotional well-being, their physical health, brain health, assess the human properly in medical terms, doctor as a doctor of psychiatry would, general practitioner, specialists in certain exact fields of medical studies that they were trained and studied for, to deal with patients, which are humans. By law, under God, these humans, potential doctors, doctors of psychiatry, are thinking in the brain, and it is recorded on this earth by the heavens, and every human, religious or not, is well known and judged immediately all their life in their thoughts, mind, organs, soul, physical actions. If this doctor's telling the truth, that they're gonna do their job and accept by law and under God to treat their potential patients with respect and always just mentioned as a valuable life worth respecting another human, their health, and physical and brain mental health. Those that they know, treat them with respect, verbally speak properly to them, advise them with proper, up to date, current medical advice, psychiatric advice, other information provided to them, services to help their quality of life, well being as a human being that they can possibly do in their job description. These doctors are asked first because there is a high risk that a doctor might not do right. And if they know morally to do right as they do but do not, they are going to and have no right to harm another life. That is considered bodily harm of another human. They have morally know not to do, and if act upon it, especially when a human doesn't choose a human, their patient, and illegally misdiagnose them. There are many to please keep in mind, doctors. I'm a victim of serious over 20 years of serious medical negligence and intelligent human myself and woman, so I speak truth from experience over many years. All these words to prevent many 100 million lives on this earth, humans, from suffering, especially the infants, the parents, and those they know. Every life affects another life. These there are, keep in mind, please listen, medical doctors, doctors of psychiatry or known as psychiatrists, general practitioners, specialists of all kinds, and all other types of medical staff, even medical secretaries that go along with this, other medical team members, medical board members, medical facility members, all mostly medical other doctors in those fields, specialists. There are ones that even swear oaths are all sworn by law under God and won't be given a paycheck of over $400,000 to $1 million approximately a year if they're going to disrespect another human life, patient health in any way. Their brain, their physical health, their mental brain health. If they're gonna not treat a human with respect emotionally, not speak politely to them, not listen to their needs as they're supposed to, have to listen to another human, their patient, what their actual medical concern or brain physical health concern is, what their human is getting even advice to prevent their health from failing, and if they want any proper counseling to be advised first, any medical advice given first, to be assessed fairly, their medical situation, their brain health, physical health, best to their trained in their job description field to do. We truly think of a human that they have a life, a soul, emotions, a valuable human life to be respected in all ways and treated with respect and assessed properly, regardless of gender, race, different religious backgrounds. These are all to be respected as well. Every human in itself, their physical health, to be assessed properly. To provide any first, especially those psychiatrists, medical doctors working in those teams, the case workers. They are mostly case workers, are registered nurses or nurses, practical nurses that have signed up to work as a team member with psychiatrists, doctors of psychiatry, doctors, medical doctors, some other ones, different specialists, researchers, clinical scientists. There are doctors, medical ones, and other ones working in metabolic clinics, trying to get patients for research purposes, which have to be given verbal consent from the patient as human. Keep in mind, humans have free will of choice, and recorded in them and every human by God are given a free will of choice given by God, religious or not. Recorded in every human, this free will of choice to be is to consent to be treated by even a certain doctor, a psychiatrist, to be have them entrusted to their care. Humans have rights. There are patient rights. There are patient right advocates. There are laws for everything on earth and under God. Every judged life is judged continuously on earth, recorded in every human, in the patients, and in the part in each human medical doctor, psychiatrist, which is a doctor of psychiatry, has a medical license if approved by the employer, who has a serious job to assess these potential doctors of psychiatry, especially. Many are unfortunately medically negligent. Those either hiring them, and they hire them and assess as best they can, but then don't follow up on doctors of psychiatry mainly that wrongly assess human health, brain, physical health for the purpose and make a paycheck can't. To have a human being, a client, to see once every 2 weeks to a month for a prescription writing purpose of a dangerous antipsychotic, a benzodiazepine, something to relieve human anxiety. These are harmful, dangerous antipsychotics, first class, first generation, second generation. All of these antipsychotics are deemed, according to me, and I'm victim of mostly all of them, of the side effects, and a woman didn't even need illegally given to me against human my freedom of choice not allowed by law and under God, but was, so I speak from years of experience and know the side effects. I was educated, studied years as child, and University of Toronto, have a 4 years Bachelor of Science honors degree in life sciences of all fields what doctors know, and the religion and Christian studies, know about ethics, ethics laws, bioethics laws, everything about neurobiology, the brain, microbiology, the cells, physiological functions, human nutrition, about genetics, everything possible, anatomy about a human being, how each life is worth respecting by the humans, the caregivers, the medical staff, the doctors of psychiatry, by all other staff working there, nurses, register nurses, be cautious, go along. I've a victim of over 100 of them over 20 years, and all swore oath to God, but are judged and by law and studied 4 long years humans to help humans, assess, help them with blood pressure check in every way a human can, and then were not followed up by the governing colleges which employ them and other boards depending who actually employ them, but the colleges such as College of Nurses of Ontario, they have a right to take away their practicing license of the nurses, registered nurses, practical nurses of all kinds. There's a College of Physicians and Surgeons of Ontario. They have the right to take away medical doctor licenses, surgeons, the doctors of psychiatry. They're supposed to assess who they hired, didn't do their job. These humans are employed and asked to. There are laws, many laws on earth and under God, but these humans judged in themselves and their thoughts actions when they employ these governing colleges, these humans that are going to hire potential doctors and psychiatrists to work with humans. Patients are humans with a brain, mind, soul, organs that have easily damaged potentially cells and cannot be harmed by another human being, such as a medical doctor. Cannot have their health, brain, mental, and physical health assessed wrongly on the part of a medical doctor, a psychiatrist, a doctor of psychiatry, a general practitioner, a specialist in any field of medicine, of psychiatry, by any then collaborated with any nursing staff. Rather, any registered nurse is a high-level nurse with extra studies to deal with other office, other duties. These other practical nurses, physiotherapists. There are many other different specialties in medical fields with their governing colleges that employ them, and asked under God if they're going to, and by law, treat humans with respect, assess their health properly, best of their reasoning ability with the most up-to-date look of research done in the world to care for the health and well-being of another human, a patient, assess them properly for their age, consider different things that they were informed about, refer them to a proper specialist, proper other further care. To think of human health first and the well-being of a human life. Their brain physical health to assess it properly in proper timing. To consider all things going on at the time if there's a pandemic, to respect this as well. Inform the patients, potential one, find them if a proper specialist or for counseling first, advice to give humans information, patients, potential ones, all possible information first for them to also to they have a right to make an informed decision, be educated by the doctor, medical doctor, doctor of psychiatry especially, affects mental and brain health they know of their patient to inform the patients with every possible information they need to know with the doctor of psychiatry, medical doctor, other specialists, or how they're assessing the patient if it's properly. If they have a medical concern first verbally spoken, the doctor and doctor of psychiatry to think of it and assess the patient health properly. Ask them have rights if the patient would go consider certain tests to prove if they have a certain health concern. Some non-invasive, some invasive, but humans have freedom of choice to be and have the right, human rights to be educated, given enough information to make a proper decision for their own health, when deemed capable, sane assessed, have to do this as well by a medical doctor, a doctor of psychiatry, obviously a human intelligent enough to consider their own health, respecting and to be considered all this information to assess their patient's health properly and give them all other options of information about potential treatments. Treatment, keep in mind, is a term geared towards maintaining proper human health of brain, physicality, or the proper well-being of a human being. The patient, a human. A human being has a valuable life and has to be respected by the doctor and our doctor of psychiatry. And respected to give enough information and assess that a treatment, if needed, to be consented by free and free of choice by the patient, a serious matter, have to verbally speak and to write down a consent to accept any medical treatment that they deem is proper to their own health after being informed properly first by the medical doctor of what the treatment is, what it is for, what exactly if it's medication, what it is the potential side effects of it, how it might positively or negatively wrongly harm a human health with side effects. Humans have a right to know these patients this information and have to be given it first by the medical doctor or psychiatrist or specialist, other medical staff as well. The parents as well are for considering any dangerous antipsychotics, which are all harmful to health, deemed by me a human and victim, know the side effects and live through, unfortunately against free will, but know that these are deemed what I know what medical doctors know and how the brain works and the physicality inside out and research that all antipsychotics that I was wrongly given and been couldn't to a woman to be avoided by parents, the father as well, and mother before getting pregnant for years and all times, during pregnancy, obviously. So these dangerous antipsychotics, there are benzodiazepines, there are many medications. All these medications are made of chemicals in a lab in a medical or depending on whatever is a research facility, a pharmaceutical company. These are all chemicals. They have a purpose made on the molecular level, molecules, particles, in terms of science, are chemicals made that react in humans a certain way if ingested as a tablet, say a little pill, in liquid form, might have the same makeup made of the same chemicals or slightly different added depending on the form of it. To consider some of these chemicals, these medications, so called, there are antipsychotics. These are antipsychotics, according to me, that the ones I dealt with and know the side effects of are, to me, considered illegal drugs that I deemed the FDA cannot approve and are not allowed to be given to any human alive. Have no benefit physical in terms of human health to benefit it or the brain mental health in any way. Have many side effects negative to human health that harm the human health more than has any benefit and are never a cure. They in fact harm the brain more, especially please remember of a human that doesn't need them at all. They harm the brain of a human even given that no human actually needs these antipsychotics if they have a brain mental health concern and their physiological health concern geared that affects starts with the brain. These antipsychotics in fact harm it more. And I'm warning in this video to potential parents, humans given these most over years are given illegally by doctors of psychiatry. It is beyond wrong by law. It is illegal, especially if a human doesn't choose, didn't give consent to be given these. These have restrictions by the FDA, the Federal Drug Administration, and other different drug administrations, well known ones in the world. Certain health boards, pharmaceutical companies know this, but have illegally and still produce these. There is a huge market for clozapine, illegal. There are more restrictions put on the FDA on clozapine and other, really, these are dangerous antipsychotics. To think of them as chemicals made in a lab that harm the brain. That's basically what they are. And harm the physical health. Most of them cause humans to be ill, The side effects: nausea, harm the thinking part of the brain, cognitive abilities, certain affect memory, a part of the brain, is a very dangerous chemical in each one of these. Depending what they're made out of, a certain chemical harms the certain part of different parts of the brain and the physical health of antipsychotics. The ones I know of, and most of them are this way created. These are essentially harmful chemicals. They also negatively, that means wrongly, affect and harm. To keep in mind, the brain, mind, the human being's thought processes, the brain controls 100 million bodily functions. Not only the ones in the brain, but in the belly, the metabolism. Humans, when they digest, break down food, absorb it to the bloodstream. Most of them have a side effect such as clozapine that affect negatively, wrongly, the blood sugar levels go up and down. Usually, most in years, if taken too many years, result in potential in diabetes, blood sugar problems, visceral fat on the belly, growing too much in humans, gain too much weight as well, as a negative side effect, harmful to health and dangerous to human body. Physicality is not used to having that much fat, and especially where the belly is, and harm the heart, weighing the body of the belly bottom too much down, harming the heart, the circulatory system. Human have blood pressure problems. The body is exposed to and needs more nutrients, supplementation if needed, very nutritious food to minimize these negative side effects continuously. These doctors of psychiatry, most, and medical doctors that went along with this, and their case managers, they're mostly like the secretary or team member working with these psychiatrists. Most of them, and I know, are over 100, over 20 years, have misdiagnosed some warning people and even made humans to act if there is a substitute decision maker placed to make act like usually it's given to a family member to do. The doctor has to assess them properly and their psychiatrist to act in the best interest if needed for a patient. If say they can't make a decision for themselves, someone that they know of, a substitute decision maker to act in their best interest of the health that the patient they know what their decision choice about to accept a medical treatment, if it is proper or harmful to their health, to reject it when it's not proper. These certain doctors, medical and psychiatrists, wrongly cannot do by law and under God or judge, and sometimes to inform people, especially parents expecting or going to have children, to remember this. There are, just because they're doctors, and psychiatrists and are smiling, doesn't mean that they are acting in your best interest of your health, brain, physical health, and are after making a paycheck. It is unfortunate. It is beyond disheartening to see that humans have no heart and know to do the morally studied 4 years and 4 years of hard studies, paid a lot of money loans to learn to respect human patient health, but are not doing. Mainly doctors of psychiatry, and have team members working with them, mostly registered nurses and act as these are mostly, I'm telling about mental health here in medical hospitals. Rather, there are mental health assessment teams of the brain, health, There are words for these. Humans have to buy fuel of choice except to go to these places, to have a psychiatrist given to them. Is all humans have choice, have human rights, patient rights, cannot be forced to have a doctor or psychiatrist given to them that will wrongly assess their brain, mental, or physical health. All the doctors know, all facilities, but these haven't been monitored as supposed to for years. The ones I know in Toronto, Ontario, Canada, over 20 years and more still. Didn't act in the best interest of their patients, weren't followed up proper timing by the colleges that employed them, have criminal charges against my life, had no right to know, and many other patients that unfortunately weren't informed even that they didn't need to be assessed wrong that way, are illegally and newcomers didn't know English, were put there and misdiagnosed with a general term. Please keep in mind, if a doctor or psychiatrist said they're diagnosing you with schizophrenia, tell them that's a general term and tell them to really assess your health properly. Ask you what you know your symptoms are. If you have a health concern of brain, mental, or physical health, you tell them first what you need medical assistance with, and the doctor, psychiatrist will assess and properly think of it and tell you what, if you have a certain brain disorder or physical health disorder, what the term actually is for this specific disorder, for this specific part of the brain, for the physical health concern caused by the brain, or depending on which medical concern you have. Each part of the brain has a specific name, is made of specific cells, and has to be treated properly. And can certain scans exist when a human chooses to go through it? To prove it, there are some medical concerns, say, such as dopamine imbalance, that cannot be medically proven by any medical known scan. Certain things psychiatrists have been speaking these words, making up certain words, and telling patients they have and they don't. So they have a client, which is illegal. There's no way to prove it. This is one I have known of. They told me, so I tell to others to be careful. That this is exact words to use can help you. There is no medical scan or the way to prove that I have dopamine imbalance. They actually, if a human has dopamine imbalance, can be already then actually the body figures it out and brain itself. Usually if a human gets well rested, goes out in the sun, lives a happy life, exercises properly, and has enough nutritious food, mainly B vitamins, worse, eat green leafy vegetables. B vitamins help the brain and metabolism and other things. Enough omega-3 fatty acids that help the heart and brain. Potassium helps the brain, physicality, and heart. Vitamin D really helps the brain, prevents depression, and the physicality in many ways and immune system. If a human doesn't have enough of these in itself, then affects the dopamine levels in the brain, but the body can balance itself out to fix this naturally. And what I stated in these just mentioned ways, there this even court by law, a human can use these exact words true to speak, to tell a doctor this, to hear this, and tell them, I don't need any dangerous antipsychotics, which don't help any dopamine so-called imbalance. You did not prove I don't have a dopamine imbalance. And most humans know of their essence, in essence, healthy and of proper brain health and physical health, don't have clearly dopamine imbalance. But humans with certain psychiatrists mentioning these terms, so please be aware. Dopamine is in the brain and it affects certain different functions from the brain messenger to the physicality. These are, as stated, proper exercise help, vitamins, normal supplementation if needed, and proper healthy diet and exercise. Living a happy life, going out in the sun, exercising. That's how it is health, beneficial to health, and have a human has proper dopamine levels. That's if needed, a caring doctor, psychiatrist will first state to human if needed proper nutrition advice only in counseling, promote a well-being of the patient, a human. About this, and needs if needs supplements to refer a vitamin or meal replacement as needed, proper diet, to recommend proper exercise, proper quality of life to go outside, to recommend and go out in sun when it's safe, get some vitamin D, and be healthy, live a happy life. Will help dopamine levels if needed. That's what a doctor has to prescribe, assess, or give advice about first. Many of the doctors, psychiatry, nurses, going along with this, many in a medical, even facility emergency rooms, then they have separate departments for a mental ward or department of psychiatry ward to be avoided at all costs unless human chooses to go there. Properly informed, keep in mind, or don't enter to save human health and life. And tell others. By word of mouth, by hearing these words, you will save the health and lives of 100 million potential patients from medically negligent psychiatrists mainly. The teams misdiagnosing humans with a term, keep in mind, schizophrenia, obviously even can is not easily spelled. It is a general term. It is not a specific mental health brain disorder. It doesn't have specific symptoms associated with it of a specific brain disorder, mental health disorder that affects the brain and physical health. It is essentially, to me, to dumb down easily to humans simply to think schizophrenia is not even a real word. Cannot have a psychiatrist or doctor put on a form a human saying you have schizophrenia. This is obviously if a doctor states this, you tell them that you're not a credible doctor or psychiatrist and I need another doctor with right to a second opinion by another credible, properly trained, caring doctor, psychiatrist. You will save your own health and life. You have the right to tell these doctors to never mention the name schizophrenia, this term, ever again to anyone. File a complaint if needed to the CPSO. In Canada, there's the College of Surgeons and Physicians in Ontario, that's the Ontario province. Other provinces have other colleges that hire the doctors that govern there to keep or take away their medical license. The psychiatry ones mainly, these ones, keep in mind a lot if they don't know English, be careful. You can tell almost most humans, but most a lot unfortunately are not educated. Humans, as well known, barely get through high school, and if it's lucky, get a job if they can afford it, go to college or university and learn further medical stuff. A lot of people even study business because cannot learn this. It is not easy to do. Any medical knowledge, human basic nutrition is very difficult to most humans, is understandable. And but in the newcomers in Canada, with high hopes for futures unseen and lost some over still 20 years, wrongly admitted into wrong departments, mental health wards don't have to be there at all, would be assessed properly their physical brain health and let go. Some are even kept there for years and would love to have children, adults, they're the parents, and some have already studied different things, have a healthy brain, in essence, physicality, went to get assessed properly with a doctor if needed, and were misdiagnosed wrongly by one of these negligent staff. Medically negligent, that means and separately medically incompetent. When they're medically incompetent deemed a doctor of psychiatry mainly, other medical staff, that means they are not competent, not properly doing their job, and cannot make their pay by law under God, and are not to be dealt with by patients. And for humans to act, if humans, remember, have cell phones, find ways credible, inform yourself, record conversations you write on cell phones, write down every word doctors say, tell them to write in records, medical records, your perspective when you're intelligent. Then you have proof legally. You have rights as a human patient. They cannot make money to wrongly misdiagnose a human with a general term, especially humans that have a bright future, that have a life to be respected, and parents' potential in this video thing. Father cares for the health and a mother and might have a child one day. A child has to have parents compatible genetically, and antipsychotics themselves are chemicals, as I stated, harm the brain, the physical health, and enter the bloodstream. And humans with these side effects, it is obviously known, but a reminder to humans to take the time to think things through if affected by antipsychotics, which are best to be avoided because they don't help anyone. As I stated, a healthy diet, exercise, rest helps the brain more. And the human to have a happy life, find someone to get along with, live a happy life, do a job, and help others is mostly what the doctors, psychiatry first have to do to remind humans and find proper cognitive therapy, counseling mostly, and never prescribe any antipsychotics to humans, especially the ones I know of that are deemed human can tell right away, or chemicals. And unfortunately, keep in mind our misinformation online, millions, even credible medical websites, misinforming potential and patients, current ones. Living humans are patients with the rights to be informed properly about these dangerous antipsychotics and are not. And especially humans that want to have children one day. The father's health affects the child too, the mother's health, and then the mother when is in the womb, especially. Certain antipsychotics a human has will affect negatively the brain even for life. So it is to best avoid in first place if you ever, and a mother especially, to ever plan to have a child. While they leave the bloodstream over time before a child is had, side effects might go away. Then really after years or so, then assessed would be have to the proper medical health, basic blood tests or any normal test done needed to assess a mother to really take a chance to have a baby. But to be careful if they're really healthy enough and it's left the system, these chemicals. Most of these are harmful to health and humans rarely recover, even after stopping taking these dangerous antipsychotics, because they mostly affect the brain the wrong way. They never, most of them as stated online, in almost every site there, well known in the world, state a general description. Stent that these are they affect the chemical messengers in the brain, mainly dopamine and serotonin effects somehow. This is not specific wordings. This is not what specifically in any way what antipsychotics do. These ones, in fact, actually harm the brain in many ways and impair this function of these certain neurotransmitter, these chemical messengers that send messages from the brain to other parts of the brain or physicality for different proper functions. They actually prevent them from functioning right. They harm more parts of the brain. A human quality of life goes down, has more harmful side effects, are become more ill because of it. These in the bloodstream affect the human millions of ways negatively, that means wrongly. Their health is impaired, harmed. And to think of this out of respect of a potential life, a baby, and throughout their life, children especially, to begin with, and the parents to help assess this, to care for their health best they can if they have a brain or mental health disorder, if they have a physical health disorder, to care, go from one doctor specialist to another until needed to find out what exactly is the medical concern of the brain, physical health of the child, an infant, say even a human of any age. Humans, children have rights. They have to have parents as and acting in their best interest, depending on age, to be educated, and to assess if the medical doctor, keep in mind, or psychiatrist, potential one, is the proper one to assess their child's health. And there are some, as I stated, negligent staff geared toward making paychecks. And to put a human even on a form illegally, which humans have rights against to do, but even sometimes accomplish, and need a lawyer to get out of this. A patient, a child, most poor people, humans are, can afford a medical negligence lawyer, are not covered by financial aid, but every other lawyer field is covered, if for poor people that can afford a lawyer. Unfortunately, this has to be changed, and whoever can please help and fix this and to the property governing bodies in the province or governments to help tell them this to fix immediately. I'm informing to children their health throughout their lives affects their future. If they ever to think of throughout their life, if they're gonna plan to have children, to stay healthy as they possibly can and avoid all antipsychotics. To think of them essentially as chemicals that harm brain and body. That's really what they are. They are never a cure. In the long run, actually harm the brain and body more. And decrease human life, are mostly over sedating, which they knock out human sleep too much, have health concerns more. They don't actually help the brain, what are supposed to, these are prescribed for, which are mostly, if prescribed to a human, never actually for what they needed for anyway. They don't have any positive, proper to health, any result in a human being given any antipsychotics. These ones that I know for sure, and there are many others, such first as that I know of and was a victim, so speak true, to avoid clozapine or clozaril. This is illegally FDA approved. Don't trust the FDA all times. There are humans wrongly working there and have no right to do, can make pay for many hundred years. They're not acting in the best interest of human health and life, and have paychecks made toward this cannot by law and under God, are judged by God in them, religious or not, and don't get away that way, have severe punishment, and have no right to wrong another human and million lives they did by not keeping clozapine off the market, along with olanzapine. There, keep in mind these are the main names, but there are the the other company names and other terms for these ones have other names for the same chemicals that are made. These specific ones are deemed antipsychotics. There is polyperidone, risperidone, these and other ones, and biodiazepines rather. Most given they have different purposes. Some are stated to relieve anxiety. These don't relieve anxiety, they harm the brain and body. A human is more anxious, if anything, and strained physical brain health if given these. And these are long term lasting effects. Once the human brain is harmed by these antipsychotics, biodiazepines, it is not easy to heal the brain. The brain itself is a delicate, tiny little cells made of certain little molecules put together, amino acids, the little protein, different, each one part of the brain functions, made of certain vitamins put together, little molecules. And these ones are very delicate, and if damaged, are not easily healed in humans, and some never healed. There are no miracle workers on earth to heal anyone. So it is best to avoid all antipsychotics, especially if a human is choosing to plan throughout life have to be healthy in themselves to have a child, a baby out of respect of their own health, the father, to avoid dangerous antipsychotics, to avoid iodiazepines. There are other and all medications. Humans even avoid such things or have chemicals such as normal like Tylenol, Advil. Humans, if they have a fever, most humans try to treat these days as every human naturally, and the fever goes down if when proper by itself, versus taking any foreign substance medications or these ones and antipsychotics, dangerous ones, remember, chemicals not good to any brain physical health and harm more. Never a cure. And shorten life expectancy of the human by 10 to 15 years will die. That means a human 10 to 15 years sooner because they have so many health concerns that they didn't need to have because of the antipsychotics that they don't need. A human with a health brain concern is not allowed to be given any antipsychotics, the ones I mentioned, because they harm more and never heal that actual brain health concern and physiological disorder health concern. Abilify is to be avoided. Another term for it is aripiprazole. This is by me knowing what the side effects wrongly given illegally but live through size, so I'm telling truth to avoid. This severely damages the thinking and other parts of the brain. There is no human alive who wants to live through this and be even thought impaired certain parts brain and physical health causes other side effects harmful to health and doesn't cure anything, doesn't heal anything. These are, as doctors, psychiatrists stating that are the negligent ones, not competent, are not allowed to do to patients. So people considering to have children, remember, avoid all antipsychotics. They will never help you. If a doctor, psychiatrist tell you these are treatment, this is, remember, terminology counts by law. All humans have rights to be informed, share this information to others. Treatment is a medical for purposes to treat, to help human health, brain, physical health, to help mental brain health. If an antipsychotic, as it is a chemical gonna harm the brain and body, which they all do with many side effects, and most need a blood testing, which a human has a punctured vein to have standard to test for in case of side effects and blood levels of different sugars, many every almost all the time, weekly or who knows when. This makes human weak and no blood and already have side effects, and this is really harmful. So many reasons why humans need to be informed and avoid antipsychotics at all costs. Wounds in the arm might not heal, might have a blood clot, some damage in vein for life, probably can exercise. Weak because not of blood drawn in a woman. If wants to have children, avoid all antipsychotics at all costs. Then you don't have to go for blood testing and be weak. Women have menstrual cycles, need all vitamins to be healthy as possible, to remember to consider even throughout the years. A human, a woman, and men too, but women mainly when have menstrual cycles as well, have to absorb as many healthy vitamins and nutrients into the bloodstream and bones, calcium. The vitamin D binds, helps it even from the sun. Magnesium help absorb it, taurine to get these from food, healthy beverages, to help build the spine to be healthy so it won't be brittle breakdown when they get older. Humans absorb certain nutrients and build on them, and can some reserve, some not in the body throughout life. And then when older, it's easier. The human will be healthier longer. When they're older, women too, and men, they cannot easily absorb as many nutrients, and then the longer they stayed healthier and were healthy and eating nutritious food throughout life, then will help them be longer living longer and healthier, because it's not easy for humans, as I stated, to absorb as many nutrients and things when they get older. So it's best throughout as a child when growing to be well rested, healthy, eat as many nutritious foods and items to be healthy before pregnant, a man and a woman. And women menstrual cycles obviously need more vitamins because they're shedding lining every month with and blood. Need to create it from proper proteins, vitamins, minerals, and certain nutrients, magnesium. All women need more than men. Vitamins all the time, more from food, supplements if needed only. And for proper hormone levels, women have estrogen, other hormones controlled by the brain. The mental health, the brain is everything affected by hormones and need to be in proper balance from nutritious food mainly. When a human is going to be given, and is best to avoid all antipsychotics, will negatively affect human hormone levels in women and men separately, potential fathers as well. To keep in mind to avoid as a child, especially throughout all years, especially old people do not need antipsychotics. They are already too old to handle any of them. Humans that want to get pregnant before, as I'm stating, that's why I'm putting children into this, to be have their health assessed properly, avoid all antipsychotics, have a proper diet while rested is more beneficial by far for their brain physical health, to have proper sleep and exercise and enough nutrients, main ones I told. Antipsychotics, remember, are chemicals, harm brain and body more, never cure anything. Treatment, they are termed by wrong staff, doctors, psychiatry. If you hear them saying this is a treatment, tell them this is wrong, it is misinformation. Cannot tell me this. By law, under God, you don't have the best interest of me as being your patient, and I reject what you're saying. Humans have rights. Is a human valuable life? Doctors, psychiatrists know and have the right to reject these doctors mentioning what they're saying, and have the right to report these doctors, psychiatrists right away, and best to do. Those then different if they break other laws, different ones. These ones there are strict raw laws. Rules cannot force a human against free will of choice to be wrongly prescribed and misdiagnosed in any way. Their brain, mental health, physical health, and be given a prescription for clozapine, olanzapine, risperidone, polyperidone, Abilify. These are the main ones that I know of. There are others, loxapine. There are many, up to 100 different antipsychotics currently on the market, all with even names cannot be pronounced, obviously because their names and they have other second, third names of the. There are different brands to keep in mind that these are specific chemicals in a lab exactly made molecules of each, say, clozapine and antipsychotic. There are made different forms of it, might have different ingredients with it in different forms to be considered, have different chemicals of everything as a little chemical molecule made of different things. Molecules, chemicals, they react with certain things in the pill itself might. These are affect human health too. Some people might not get allergies or reactions against clozapine or other antipsychotic medications, but might get an allergic reaction to what there's a little coat around the pills. The little, if it's a little capsule, what is made the capsule of? Is it made of different little molecules, chemicals that might make someone ill too? Not only the antipsychotic itself, medications, benzodiazepines. Most are given these antipsychotics and oversedate a human to the point of sleeping for 12 hours, almost knocked out cold, by negligent staff, even admitting wrongly humans to be aware to mental health wards so they have a patient to see. Illegal. If human doesn't choose consent to this beyond means, cannot be done by a doctor, psychiatrist, sworn oath to God by law. Humans have rights to reject this immediately as soon as you can. Right away, walk away, report the doctor to the college, file complaints, get rid of these humans working there. They're not respecting a patient, human life, yours. There's choice laws, human free choice, patient rights, and other things they know. So if you're going to become pregnant, you are considering of having a life going to be grown in the womb, a little baby that in the bloodstream of the mother after, and there are the fluids when the father and mother do their business, in essence, have sexual encounters to have a baby, to consider the fluids, the bodily content of the sperm from the father, say, and the mother, the eggs. Each of these are made by humans, best without having antipsychotics in their bloodstream, because antipsychotics, as I stated, have many side effects and harm the physical health, the metabolism, which negatively affects the bloodstream, could negatively affect the sperm, the eggs. The two join together, this sperm from the father, the eggs from the mother, together make the little baby a live human that has rights to be respected by both parents before it's born, to respect their health all years, to avoid dangerous antipsychotics, benzodiazepines, all other medications. All medications have some kind of chemicals. You have a certain purpose to I have their proper to treat a certain part of the brain or physical health, but are chemicals. Best to be treated naturally with food supplementation if needed to avoid these medications, and make sure some if needed temporarily that are beneficial, like say someone takes if they can Tylenol to relieve fever. Make sure it is best out of human bloodstream after many hours a month before even considering to have a child. They are chemicals, even Tylenol, Advil, made for certain purpose in the body, but are go absorbed into bloodstream, the bloodstream of the parent, the mother, the father, and then especially the mother when having a child and in the womb. Is best to avoid these even throughout life before getting pregnant, to a human to have enough proper nutrients and proper blood and cells and have the least amount of chemicals throughout life in their bloodstream. to make a proper, healthy child. And then the mother in the womb, to everyone to please listen, remember that any medication, as all humans know, is taken internally by mouth to is then digested in the mouth, broken down, swallowed through the food pipe, swallowed the organ's delicate cells to the stomach, breaks it down further, digested, then intestine and absorbed to bloodstream to go to where it's needed for a certain function. If it is deemed beneficial to health, it is used, but to be avoided unless needed. Antipsychotics, these are not beneficial to human health, are never treatment. Never treatment. Treatment is to help human health, brain, mental, physical health. These are never treatment. Antipsychotics are harmful to the brain, body in many ways as stated, and absorbed into the blood. The mother has a baby, has to eat nutritious food and vitamins, proteins, made up of little broken down to amino acids, building blocks of life, which they're termed tiny little ones that make up other different cells and brain and all organs, muscles. To have a nutritious diet as needed to avoid throughout life, since a child to an adult, and in the womb is a long time, 9 months, to avoid. No matter what a doctor says, never take any antipsychotics that you deem are harmful. Most of them are chemicals, harm the brain and body, are absorbed when taken in mouth, tablet form, liquid capsules. They're in the body, absorb even in belly, have other side effects too. Nausea, most, some of them, not all, make humans tired, harm the brain. Obviously, cannot be given to a mother with a baby infant in the womb. If a doctor tells you this to give you antipsychotics already even pregnant, then obviously they're not acting in the best interest of your health. Rather, and psychiatrists definitely not, and any other medical staff, and tell them that you have the right to file complaints against them. They didn't assess your health properly, have no right to misdiagnose you this way, and to potentially harm another life of a baby is developing new brain and organ cells in the womb, and your brain and physical health. And say you want a second opinion from a credible, properly trained, caring doctor, medical, psychiatrist, human have rights. Mother has rights, the baby, even in womb, has already a life, has rights. As a human, a patient, free will of choice given by God to be cared for and assessed proper brain, medical, physical health, rather, by every medical staff. They know are trained to do. A dignity of God within them to be respected and is recorded in their life too on by the heavens in the infant in the womb and what the mother does and the medical staff separately, each one elder thoughts, physical actions recorded, judged right away on the earth if it is proper for their lives, affecting the infant lives, and the doctor, medical, and psychiatrist's life affects their assessment of a life of the mother, the brain, mental health, physical health, and of the baby. There are bioethics laws affecting human life that have to be respected. Our boards, humans, they're all not doing their jobs either. The colleges to be informed to fire negligent doctors and psychiatrists immediately to respect of your life and health of the baby and of other humans to make sure they don't harm anyone else potentially and not make $1 million to up to approximately a year paycheck. They cannot make money by under God to negatively assess human brain physical health and especially not of a mother with an infant in the womb. They obviously have no respect for what their job and they studied years and mother raised them right. Respect themselves and mother to negatively assess a human health of another human being they cannot, by law under God, know, and of an infant to endanger it to prescribe antipsychotics. But many have done, and have online misinformation, unfortunately. So please, whoever can, doctors, and even hearing this, and basic, even high school life science, nutrition, human study, and university level students in the world trained in U of T, Harvard, and many in the world, every country, do your part. Clean up this online. You will save the health and lives of 100 million humans and babies that don't deserve to have dangerous side effects and live to a mother too tired, over sedated, uh, mistreated with antipsychotics, and have different blood sugar problematic levels, nausea, while the baby's in the womb. While the baby's in the womb, it is protected certain ways, but the mother's diet, it goes to the nutrients to the baby, and the baby has gets to it some chemicals from the bloodstream of mothers from the antipsychotics, and side effects will negatively affect the baby that is growing entirely new organs, brain, and has no right anyone, even the mother and medical staff, to negatively treat this baby this way, to disrespect its God given dignity, a valuable life, its health, brain, mental, physical health, its new cells that need vitamins in itself to grow new organs, its free will of choice. They have no right to disrespect it, has choice and human rights, patient rights, an innocent life by the mother, the parents, the father, whoever's assessing this, caregivers, the medical staff all know. It has free will of choice to be treated with respect, its organs, brain health, physical health assessed properly, and choice to be respected by its mother, to have a proper healthy diet and avoid any dangerous, harmful to brain and physical health in many ways. Antipsychotics, so it doesn't flow to it's in the womb in the womb from the mother to the infant to harm its developing new brain, cells, heart, organs. By law, as lawyers know, under God is recorded, judged if a mother neglects a child, if it is even inadvertently, but the mothers know, as they say, because they know they're growing a new child and care for it. And the father is a child even throughout years to take care of their health, avoid even any substance foreign to body which is harmful. Caffeine from coffee in pop damages stomach lining. Humans become ill and more prone to inflammation and allergic reactions. Cannot obviously have children after unless they really have a healthy recover health from it. Alcohol is essentially, think of it as gasoline. It is chemicals. A byproduct in itself is disgusting, as all medical staff, other humans know. Alcohol is a byproduct from a lab. It is disgusting in itself, or chemicals, and no one wants to drink it. Poisons from the internalized to the belly, harms, burns the mouth. It is toxic chemicals, burns the stomach lining, mouth, this taste. Women can have damaged tongue, impaired taste, burns the stomach lining actually. Absorbed to bloodstream, then a human has bladder problems, liver more problems. It have a problem. These organs are very delicate. Once damaged can be healed, have lifelong damage. Whoever drank already, the father, the mother, cannot obviously respect out of respect of their lives and health and dignity of others, and the child potential not is best not to have a child. A baby, unless really recovered healthy and maybe drank a little bit and recovered. But definitely not when a baby is in the womb. For a mother knows and everyone to avoid these are chemicals, caffeine. Almost everything is made of chemicals. There are even foods to avoid. There's modern research people have done for years, carrying humans to look up online. There are certain even fruits, vegetables to avoid. While the baby before a human is born and then put in the and growing in the womb and during, there are certain things about grapes or the skin. They were found and other things that they're obligated to do and inform others, then they will know about it. Help them, be earth angel humans. Use your kind mercy and help perform a merciful act of kindness, compassion from the heart and from your kind heart and soul to inform these people, mothers, fathers, potentially uh, that are gonna have a child. That there are simple food items that people think, okay, this is helpful, tomatoes, but they have certain items that harm the stomach lining in most humans, so best to avoid. Certain ones, especially then when in the womb, have an infant for 9 months. And there's the certain things about grape, this skin, to certain things to avoid her to be further found out, but certain things about people thinking, oh, fruits and vegetables are good. Certain ones are all made of different little chemicals. Each one have different certain vitamins, minerals. The skin to consider might have pesticide these days to be careful, viruses, germs, coronavirus, different things on the surface to consider too. There's this microscopic everything is there to be considered by the mother and the father. Might be absorbed to the bloodstream when after ingested eaten in the mouth, and then to the stomach breaks it down to intestines. The body can only break down, fight off certain things if it's foreign, not good, and pull the rest out. The rest isn't human negatively affected and gone to the bloodstream. Humans become ill. So over time, it's best to be studied and avoid anything you think has a chemical, any medications, as everyone knows, to not take unless and it's really beneficial. Short time, a small amount is needed to help the health if needed, to assess if it's proper to your health. And if you're ever gonna think of having children, to tell children early on, care for your health naturally as possible, eat healthy, be well rested, avoid becoming ill in the first place. Avoid all dangerous antipsychotics. They're chemicals, they're not helpful, never cures. They don't help depression. Avoid ECT, electroconvulsive therapy. This is termed therapy. Whoever put this term is misleading, as already for 100 years people illegally cannot do this. The term needs to be changed, gotten rid of entirely. When against free will of choice, it is considered to me electroconvulsive torture. Torture is a bodily harm against a human free will of choice. Didn't give consent choice to be harmed this way. The brain is a human fasting procedure injected with general anesthesia when already dehydrated from fasting, 8 hours, with no blood, enough water in the veins, hard nutrients, and essentially knocked unconscious and electrocute alive the brain, with electrical real currents on both sides of the head put past through the brain, with not enough nutrients, electrolytes, glucose, water, blood in the vein to the brain, and knocked and electrocute physicality and other side effects, and have damaged brain from venipuncture, and wake up cannot remember anything, almost anything from recent history, loved ones, children, family members, love pets, studies. This doesn't help anyone, especially I'm warning humans that are going to have children one day. Avoid ECT. Is illegally approved by FDA for years. I'm a victim of serious for years and didn't need. I'm warning so other humans who want to have children consider this. If a doctor psychiatrist says to prescribe ECT, already alarms go off in your brain, say they're not acting in the best interest of your health. Say you want a different doctor, psychiatrist, report them to their college of physicians, surgeons of Ontario, or call it this college where they're employed, and file a complaint, or a lawyer gets to sue them. If sued or file the proper charges against them, or proper laws to rectify what they did wrong. Wrongly assess your health, cannot do, by law and under God. They swore oath to God to care for human respect health. When they don't, cannot do, and make pay for this and have to have their pay taken away. If they act upon against freedom of choice to wrongly prescribe this can't, they have criminal charges and cannot force a human against freedom of choice that doesn't need it, especially, and even need it or not, against freedom of choice cannot give human prescribed ECT. This is very dangerous. A human actually has to really consent by choice to go through this procedure, and no human does want to. There is no physical benefit to any human alive, especially this is misinformation. Please listen and help anyone who can to take it offline. There are millions of websites, still even medical ones. There's Mayo Clinic, other ones associated with well-known universities too. Wikipedia, no one updated this. This is illegal, and especially human doesn't choose to. The FDA has still illegally approving ECT. There's other brain stimulation procedures that a human obviously affects brain to be really cautious about and avoid at all costs. Unless they do the research and really have a specific brain concern that they know it will help. Do educate yourself as possible properly. Make sure it's a caring doctor assessing your health properly. Get a second opinion, obviously, even third, before going through any dangerous procedure. But human intelligence will choose and inform themselves about that. But most brain procedures, if they require electrical current or some other foreign substance, chemical to be injected, affect a brain, there are those antipsychotics, biodiazepines, other ones that I didn't know but are can easily be found online, can be seen, or chemicals. If these states are for schizophrenia, psychosis, for mania, these are general terms, not specific brain mental health disorder names, no specific symptoms associated with the brain human might have already. These consider to simply think of as fake words. If a doctor states you have schizophrenia, you might have psychosis, mania, then these are not credible, proper doctors. They know these are not psychiatrists properly doing their job. Nursing staff million go along with this. Please be advised, I'm warning you, speak truth to prevent 100 million people from suffering and dealing with these individuals. These medically incompetent, negligent doctors. Psychiatrists, most don't know English. I don't know how they even got to practice, but have. Colleges I even felt took up to a year and a half in investigating where they could see the medical records clearly, take away their medical doctor and psychiatry license, and put them in prison with criminal charges against a human life mine, harm my health and physical woman health, and couldn't have kids because of side effects for 20 years. So it's best to avoid these humans to begin with. I'm informing humans, and please do your part online. There's some even main sites that remember million people view for look for advice, think they're proper medical sites, but no one updated. Not even doctors took the time to care. That do their jobs. But I've seen, and I'm only one human, can only do few, but on these sites could be updated by even humans there. Certain Wikipedia, other sites, humans can contribute proper, intelligent definitions and update this to get rid of the terms schizophrenia, psychosis, mania entirely. Millions were put, even humans choosing, trying to get pregnant, different ones stayed online. Those humans that are stated on the files to have schizophrenia, psychosis, mania, and other ones, these are the main ones, are general terms. They don't have a specific mental health disorder, brain specific part of brain mentioned, symptoms at all. These are fake words. To get rid of these from the entire practice of psychiatry, medical journals, everywhere online. With doctors and FDA and whoever other boards, medical could be done, whoever has these websites have to do, and get rid of these entirely from the world. Millions of people like myself were wrongly when needed medical wards, went to emergency and have on file already schizophrenia didn't have, is not even a real mental health concern as stated. It is a fake word, in essence, and would have been put in a proper medical ward assessed by a doctor fairly and let go. Had a medical concern in my situation, but they seen human put on this and can't in a schizophrenia on the file already and already thinking, okay, put in mental world ward side in case or instead of medical one. And this staff knew to assess and what I'm saying intelligent, but some wrongly go along with it so they have a client in mental health ward. And once there, it's not easy to get out. And these humans cannot do. Humans' rights have choice to not enter there, especially when had a medical concern, and don't have to be there. No human alive wants to enter a mental health ward. And these need to be fixed in world too. But millions have suffered. People online even misinforming people other patients have keep in mind are not true stories online. Schizophrenia. These are poor people to inform them. This is a fake term. People misdiagnosed and given 3 even antipsychotics and different one see which one works over time, which none work because they harm the brain. And they don't need even children. And these doctors making illegally money to harm they can by law. It is as serious as human thinks of it. A paycheck cannot be made for a doctor given to harm a life and make money for it to use to go on vacation. It cannot by law make a pay, and under God, the recorded judge is severe punishment, no right to harm another life in their thoughts and their actions to wrongly misdiagnose with schizophrenia, psychosis, mania. There are other ones. Keep in mind, whoever already has or knows humans, you will speak this information to them in this video will save their health. They might have children one day. Remember this right? To be healthy as long as they can, especially the brain, cannot be healed easily. One little brain injury might last, even side effect from these dangerous antipsychotic, even if a human has a fever, even given taking something might inadvertently cause a different reaction in them. So even every chemical, even Tylenol, Advil, all are chemicals to be avoided unless really needed properly. But dangerous antipsychotics are very harmful and cause too much brain and body health problems. Side effects in the long run never cure anything, never treatment that's proper to medical health of the brain, body at all. Cause more harm, and especially human that doesn't need it. And a human already that has a brain, mental, or physical problem causes more harm, more different brain parts of the brain, physicality, than already they have, and that doesn't actually help anything. That this negligent doctor psychiatry prescribed it for and couldn't because there's nothing that actually they prescribe these antipsychotics, benzodiazepines to the patients because they don't have it. Humans, even by choice, misinformed, consented over the years to clozapine, but were not told the truth. Clozapine is deemed by me, a human, a humanitarian, public figure, or angel, a human that lived through a victim of these serious side effects, didn't need, and a woman couldn't have children because of side effects for years. Didn't even need, but intelligent, choose to use this information and university studies to help inform others to prevent their health from failing. To inform others and get rid of this is termed in the world knows misinformation. To get rid of clozapine off the market entirely, to get rid of it. Clozaril, its other name. Olanzapine, risperidone, polyperidone, loxapine, Abilify especially. There are pharmacies that go along with this. The pharmacist geared towards, especially with clozapine, is a huge market. Needed to be shut down years ago and never started. The pharmaceutical companies making this by law under God can't know they're morally doing wrong and 100 million people suffered while they made pay. Cannot could have hired someone who they had to monitor this and care and use the get the pay to do something right and never produce clozapine. Never put it on the market, never make any form of it, never promote sales of it, to never make sure there are advertisements online, to make sure they're not there, to make sure that there's a pharmacies that are geared toward clozapine and people come in and pick up prescriptions every 2 weeks, 1 week, a month. By negligence, doctors prescribe all of them. Technically, all the doctors misinform patients by then they choose or not. Their human choice, some are like informed properly, some not, and given pushed clozapine. A lot done illegal research on against freedom of choice cannot be in journals published by negligent doctors of psychiatry, and these made extra paychecks in affiliated with universities as lecturers, professors, well known even at say U of T, others in other universities well known in the world that teach the future children minds, future doctors, psychiatry, medical doctors, nursing, all different fields. Very dangerous for these humans to work there, but made an extra pay and use this money to bring to their family children while they harmed needlessly lives like mine, live homeless on street, brain damaged, with the disability not funding enough to help this, poor, with barely the clothes on the back for 20 years, newcomers with high hopes have damaged brains, put in wards with no food, enough nutrients, humans that high hopes to have children, to get pregnant, myself included, needlessly harmed, didn't have to be, and I intelligent fought against, but couldn't afford lawyers. These humans didn't assess health properly, so I'm mentioning this information to prevent any humans from suffering anything that is harmful to their health and potentially prevent them from having a child. Humans love to and care for to have a child, have a right to do, and some I'm warning them of these things, so certain things to care for their own health, the father, the mother, to consider previous generations of humans that were put on antipsychotics that could have caused brain damage or certain disorders in children already born, or so the humans already know to assess this if they're going to be healthy enough, their health, to have another child, their own, I mean, their what happened, what's physical health they have already, to assess it. A child's life is a valuable life. Is no one has a right to the father mother to have a child if they're on antipsychotics. Any medication that's is chemical, obviously harmful to the brain, to the body in many ways, requires frequent blood testing as stated, which is harmful in the vein blood. There in online it states that women pregnant, ECT, it is a fasting requires in brain body electrocution. This state is safe in case some antipsychotics don't work. That it is safe for the mother to go. This is not safe for a mother to go to have the fasting when she needs nutrients to the baby, to the womb for 8 hours and be dehydrated and to have their brain body electrocuted really alive and nerves brain damage and memory for life and the infant negatively affected in a womb when a mother knocked unconscious. But every site, Wikipedia, other medical well-known sites, mostly there's other Mayo Clinic, even children departments stating about ECT, electroconvulsive is termed therapy, but I put in quotations therapy. This is not therapeutic, beneficial to human health. Brain, body of an infant, definitely not. Has long-term side effects of brain memory damage and human fear and a suffer heart attack. I even think of it and don't want to live through it. I lived through it, so I know an intelligent human what doctors know. Doesn't help anyone. Humans with depression avoid it at all costs. Women becoming pregnant before, during, even years. Don't ever go through ECT. Get help. Complaint file these humans going along. There's 10 people working at ECT clinic. Physiologists, doctors, psychiatrists, board members go along with it, make $1 million and harm lives. Even informed, misinformed people pushing for this depression. I cannot, I did not have the heart, so please clear up this misinformation and act. You'll keep in mind is the World Wide Web on internet. People looking are have different health brain concerns, want treatments to help them, but are misinformed. These whoever wrote these, please clear this up. Educated who know doctors, even basic high school students that studied university. Take the few seconds, edit those sites properly, get rid of these terms. Would whoever works in pharmacy or different ones put the real definition of antipsychotics, the modern one. These are basic, generally defined on Wikipedia and other medical well-known sites, which is beyond wrong. These are not what antipsychotics actually do. Each specific one is not specifically stated for which part of the brain, has a general description, which doesn't even have anything to do with the actual each clozapine or antipsychotic chemical the pills are made for to do. Very iffy wording. They put the words might cause a side effect, might this. This is not allowable. There's enough research done to know what exactly part of the brain body these affect and how wrong it is. This is not information put online, and humans have right to know, to inform themselves. Patients, human free will of choice, rights, a valuable life, dignity of God within them, religious or not. Record on all humans, physicality, brain, mind, assessed by heavens all times. Humans to care for their own health have rights to be assessed properly by doctors, sworn oath to God, so they really have to do right. Religious or not, doctors, psychiatrists, nursing staff, all jobs, actually the medical ones too, actually swear oaths to God when they say an oath to, so that they will, and the people hiring them know, record that they will do properly under God to assess human health, or they won't hire them. But many are hired and then do wrong, and have done wrong, cannot do and make pain, harmed, and live their happy lives. And humans can afford lawyers, medical negligence, which have to be fixed if they're victims by the province governments, Canada, states, other countries right away. They didn't do their job to hire proper staff, colleges that hired proper doctors they had to do. By law, humans can file easy complaints, criminal charges if needed, if harm their life and they're put in prison. Against free will is torture, illegal, fined by imprisonment, taking away their paycheck, and these humans put in prison. Doctors, psychiatrists, and especially of a mother. Misinformation needs to be taken down from the internet. As I stated, these are exact, carefully selectivized words from human of years of experience and seen different things, doesn't want anyone to suffer, especially potential babies. Born into the world and mother then has to take care of them. A human baby has the right to have a healthy mother and father. There to have enough, nothing foreign to the body of the mother done that will harm the baby, especially not ECT with the brain electrocuted body. The neurodiamond is knocked unconscious itself dehydrated, with no blood and no nutrients, and the baby in womb is negatively affected. How is this helpful to anyone? It is not. It is illegal for the mother to be harmed, especially doesn't choose. And there's, if a mother consents by choice for ECT and doctors misinforming her, they have doing a beyond wrong under God can and cannot make pay. So I'm getting rid of these doctors, everyone to warn people. Get ECT if you hear it is wrong. Simple version beyond wrong, illegal torture, especially human doesn't choose to go through it. Mothers, potential mothers, fathers avoid ECT. Children should not be gone through prescribed ECT. A baby definitely in womb cannot handle it, doesn't deserve it, has its own choice rights, and definitely will react against it and knows it doesn't want it, doesn't deserve it. It has a brain, mind, soul, and cannot go through ECT. Cannot is recorded by God in them what the mother's actions are, and doctors in this situation are judged and even until when they're dead are punished severely if they disrespect an infant's free will of choice. And a mother puts endangers her life and goes through ECT and knowingly knows that it might endanger the baby's life and she doesn't need it. And the doctors have no right to have to misinform online, so please, he and whoever did, to take this information down, even get rid of it entirely, and then notify a doctor, say please make a site. They can put a little site, easily done website links, and inform people properly what ECT is, and whole world will view. There are 100 million people stating having schizophrenia that don't. They have a specific mental concern of a brain part that maybe needs treated, health assessed, mostly counseling, proper nutrients, rest, exercise. Maybe in a naturopathic route, prescribe proper nutrients on the part of a caring doctor. Psychiatrists in essence have to be either gotten rid of this job entirely or really do their part and accounts as a counselor and a nutrition advisor. That's what a psychiatrist, doctor of psychiatry actually supposed to be doing. Advising human about it because they're dealing with a human with a brain injury or brain mental concern problem and it affects the rest of their physicality. These have to be specialized doctors more than any medical doctor, no, are mistreating, unfortunately, people with brain injuries, misdiagnosing them with dangerous antipsychotics, forcing as well to be taken that harm their brain and physical more and not helping their actual brain problem. It is disheartening human cries to hear these people swear oath under God and morally judged by true religion or not in them and make their pay and go on vacation with their family and write prescriptions for these once every 2 weeks and leave and don't care of their patients' health and well-being rights and need to be put in prison right away and have human patient rights to do. Human couldn't have children like myself and other newcomers seen for years and legally harmed and put even in wards on forms illegally. So we stay there so they have a prescription to write to a patient once every 2 weeks and leave. And then people don't know to say, look, I don't need this high dose. I don't need, misinformed, not given enough. The doctors don't prescribe enough nutrients, food. Nutrition is almost nothing. And people begging on the street for food without disability money when they're disabled because the doctors were negligent. The Canada, Ontario governments didn't care enough in them to hire proper staff, medical as they stated, and colleges to follow up on these doctors, psychiatrists. So I'm warning people about this in world Australia, in Canada, Ontario, and Toronto, Ontario, most well known in world. Certain centers like CAMH, previous CAMH, new Tamerty going along with this, whoever's funding this, ECT, the emergency facility, they have billions of dollars, even asking for donations. Be cautious. Make sure the funding, they already have the funding. Don't donate to any of these people in Mount Sinai too. They have the $1 billion. Use follow up on humans to see if they're actually going to proper research the care and benefit humans in those places haven't. The budgets are from the actual Canadian government. In Ontario, depending on province and in states, every country have their own budgets to fund research and things like this, not from humans. So be cautious. Don't spend your hard-earned money. If you want to raise children, make sure to be healthy and promote your own health. The father too, the child. And remember, every antipsychotic is a chemical harms the brain. Yours goes into bloodstream, will flow into baby's bloodstream in womb, is no good. Baby will be growing, is even not even born yet, and growing new cells and will be harmed and have a potential of brain damage. Even while growing is a long 9 months, 100 million seconds, day and night for 9 months, almost a year. They won't develop properly, won't have a proper hard grown parts of the brain, will already have chemicals in its suffering and innocent life growing new cells. The mother has no right to disrespect a life this way, as known. The father knows to be educated to avoid antipsychotics before, mother as well, for years. Even simple Tylenol, people advise to remember, have chemicals unless needed, lower fever a bit. Advil, something deemed safe at the time to make sure it's out of the bloodstream, but they are harmful to health. These are not medications. Even on term, this misinformation, if people please help get this offline, call a doctor and they can help online. These sites know all the terminology laws, lawyers, legal and clinics, someone, even student legal have this, know this, and if you know, it will know this easily can do and online can fix certain things or the update some sites, know how to contact them, and will save 100 million people's lives from potentially suffering this and being misinformed. Get rid of schizophrenia, psychosis, mania terms entirely. Consider them misinformation. These terms, I already put a video, more detail about this, and I'm a victim true. And I have a bachelor honors of life science in every medical type field per se. Brain inside out, no neurobiology, everything, physical health, what nutrients needed, symptoms if they don't, and a victim of the side effects of the major antipsychotics I stated were given illegally as ill, and I know what all the different things I stated happened to me, and I couldn't have children, result of being disabled, brain memory damaged, ill, sugar levels going up and down, blood overdrawn in a woman too, needed more meals, weak until the body grows more blood, frequent blood testing, venipuncture, they cannot human doctors endanger life and make pay for it. To think of this way, there are human dignity rights laws, choice, each one by lawyers assessed. There are legal cases to be won. When proper criminal charges even filed when a college is looking into something, can afford a lawyer. They couldn't hire these doctors to change it, so they give money to the victim. They didn't do their job, cannot make their pay. So they told me they can't give me money for it. But I have rights, illegal to live. They wrongly hired doctors and college members that didn't look in and care for my health. Lost 20 years. Disability didn't give me any money enough for 2 nights out of the cold, and I'm a victim of Ontario. Their job to hire staff, and millions are too. Newcomers not even told and give have no money to and go on the street begging while even in the wards because the doctor's not prescribing them even meals throughout the day enough. Not even a supplement that I knew of helped some patients, but they're still not and suffer still there some 25 years. So it's best to be avoided. Humans want children. All antipsychotics help those people in wards. Humans can other dog have a second COVID, but go and help and look into this, walk around and say, look, I'm here acting in best interest. Can I make these wards? I want to see what's going on. These doctors, and I have a list over 50 and 100 to 150 negligent nursing staff and others, pharmacy staff and ECT have 10 clinic workers, secretaries going along. There are psychosis teams. These are the doctors, psychiatrists, most negligent, not competent doing their job, with a nursing staff like a secretary helping with the case file of the patients, wrongly making paycheck too, going along with these doctors, and went on vacation with the money can't. Well, they harmed patient lives. Supposed to do right and make only pay by God and to make money to help people. They held what they studied for years to do, but didn't and still are not. So please help get rid of even misinformation online. These staff, if you know, complaints work to the proper colleges. If they don't do their job, push the issue, find legal clinics, whoever can, lawyers to look into this. Lawyers expensive, but some other ones, even medical ones, to push issue for victims to be funded. Get rid of these and it'll prevent other future humans children might have children healthy, not prescribe antipsychotics they don't need at all. No human needs an antipsychotic, especially the ones I mentioned. Other doctors, please, you can look into this. You know all this. Psychiatrists, credible ones, get rid of the other ones. I don't know why they haven't acted online, anyone, already for years to do this. And other ones know about other ones haven't done anything either, even online to look and clean up this and are made pay and under God know our judge never get away with it. But there's 100 million people and no one acts, so please even take my information, whoever best can, with a proper up to date can look online. There's the up to date new research. Ask a doctor. Say this is what Angelica went through. She's telling the truth. The victim have millions of medical records to prove it. Credible, true information is true of anyone thinks of it. These terms are fake. Misinformation now. Schizophrenia, psychosis, mania, other ones, humans look into it that have been had deal with mental ward victims will help. If it's a general term, it's not a specific brain mental disorder, tell to the doctor, someone medical field boards to get rid of it and tell them to get rid of it online, deem it misinformation. Let the main sites know on Google or whoever how this works and it will get determined there online. Everyone knows what this means these days, doing mostly their part. Term misinformation, if it's not based on any true a word, if it's gonna harm human health, misleading in any way, not credibly proven by science or medical field or any research, it is deemed misinformation. And this is all has to be got rid of online. Unfortunately, there's hundreds of sites, some even main ones all of them, but there are medical main ones that have hundreds of misinformation in this field of antipsychotics. Pharmaceutical sites, doctor, even well-known associated with Harvard, Maine University in the States, University of Toronto, PubMed, isn't doing their job entirely. There are misleading psychiatric journals. There's many videos still about schizophrenia need taken down, misleading. Even patients misinformed, spreading wrong information they unfortunately didn't know, or some on purpose acting. The markets, there are humans hired actors to keep in mind. Humans potentially having children about schizophrenia is, as I stated, a fake word. Psychosis, mania, schizoaffective disorder, these are fake terms. There's no actual brain specific part mentioned that is affected, have symptoms. Someone has this brain thought process damage or something. That is a specific brain health symptom per se. It is, and it would be there's each part of the brain has a specific name. All doctors know specialists, brain specialists. Even if you're questioning a psychiatrist, get a medical doctor and go to assess. Go get and ask for a brain specialist then or neurosurgeon. Surgeons are very educated, and you might be better off that way to get a proper medical opinion about your brain mental health versus a psychiatrist. It is true spoken words. But careful, every doctor who knows most surgeons have higher level studies and really swear oath to God to do everything in their job description to prevent a human from going through surgery. To assess human health properly and brain health, and especially of a mother, potential parents of children, infant to consider if it's in the mother's womb. Will never prescribe any neurosurgeon, specialist rather, pediatric doctors. There are pediatric files these other specialists deal with children online, misinformed, stating that ECT is safe. It is not safe for children, for mothers with a chill infant in the womb. This is misleading. They put general words, so they kind of weaseled it out by law. But those who know by law that they cannot do is illegal. These terms are misleading to all humans, is misinformation, all 100 million online. I need humans to act. I'm only one human, can only tell them correct one or two and whatever I can. But there's the actual humans to contact that know the higher level doctors and sites to get rid of this from those websites and the higher numbers that I don't have and most humans don't contact to the pharmaceutical companies, which an intelligent human myself tried would have is almost impossible to find their head office numbers or where they're located because they make millions illegally and mislead rather millions of people and making illegal billions of dollars promoting dangerous antipsychotics and need really a human that knows their contact number and to push issues and lawyers potentially or someone educated higher level doctors that us and boards that know this contact information of these places to deal with them, to even file complaints to the government, tell them to ask which boards to call a phone number and please push the issue and they will look into this. It hasn't been done. That there's research done for years to clearly show antipsychotics are all harmful to the brain and health and of all the potential parents and to infants in the womb. And remember, after a baby is born, it has to be respected. The mother, while breastfeeding, lactating in the chest, produces the milk is going from the bloodstream. So antipsychotics, medications, even basic ones, avoided a better is even Tylenol, Advil, but definitely antipsychotics harmful to brain, remember, and body health. Need blood testing, blood week. A mother obviously can't go through that if she's gonna care for a child in the womb and after while breastfeeding for the months needed, and it goes to the milk through the ingest into the mouth or injected, depending what the antipsychotic how it's put into the human, and then absorbed into the bloodstream to the milk, and the baby will internalize, become ill. Chemicals that harm the mother can handle as adult have lifelong some side effects, harm the thinking part brain, over sedate, that be too tired the infant when it's growing new cells still after born, new muscles, new heart, brain, has a no right anyone to disrespect the baby this way. It's free will of choice, not to be harmed this way. Its brain has a right to grow healthy new cells for the mother to breastfeeding it to while breastfeeding to make sure she still cares for her health enough not to take any antipsychotics because clearly they don't help her health, the brain, physical health, and will harm the child in the milk, breast milk, for number second million months, seconds, million seconds during the month rather, while she's still breastfeeding and the baby internalizing the milk. And the baby will become, if have these chemicals in it, have side effects it doesn't deserve. It is not allowed to be disrespected. Its dignity of life recorded by heaven in itself, religious or not, by another human, especially the mother. No doctors have the right to misinform any mothers, fathers, any human alive, children throughout the years, old people, mothers lactating, having breast milk when in the womb, nursing staff that went along with this can't, physiologists, specialists, pediatric physicians, some go along with it, most care about mother and children, no, but not entirely doing their jobs. Some still misinforming humans about certain antipsychotics, ECT, not preventing it from even to leave it out of their thoughts entirely. These are not treatment. These are harm. It is misinforming a patient. Doctors, psychiatrists know to a mother to prescribe in any other human and before the father. and especially a woman with a baby in the womb or after breastfeeding, antipsychotics or ECT, and any other medication are all chemicals that they don't need and deemed harmful. They know, or they know which ones they are. They cannot say they don't. These humans are not acting in the best interest to respect another human life, the patient, their human rights, the patient rights, their human free will of choice to be informed, properly educated about these things being not proper to their health, and they know right to do, but most there are a lot of humans misinformed. So if humans act now, please view this video, share it to the 100 million people, humans in the world that need it. Millions still suffering with term schizophrenia misdiagnosed unfortunately by negligent, mainly psychiatrists. A lot of humans pregnant, about to be, children in the womb, needlessly wrong, harmed, because misinformed humans by humans making pay and cannot, by law under God, and disrespect a life of a human mother. A child in womb definitely can, that has rights to life and health, and then breastfeeding after, where the milk and has chemicals from these medications, antipsychotics, harmful medications rather. To me, they're termed, I use illegal drugs. They are illegal. They are illegally, keep in mind, FDA approved, according to me, a human victim all. I have human rights and human to please help look into whoever works with FDA to fire these humans after hundreds of years, illegally mistreating and misinforming humans online. They put in recent years some more restrictions of why a human cannot have clozapine as needed, but they didn't keep it off the market. Making money still, no, and harming million lives and people misinformed. The doctors son got away, go with this. Psychiatrists cannot do. Medical doctors boards, as even CAMH, previous CAMH in Toronto, Ontario, the staff all went along with it. Nursing staff, one after another, smile and leave. When they don't even look, remember a patient in the eye, then most likely the doctor or staff is not doing their job and not acting in the best interest of your health, and don't trust them. Especially a potential mother, father, going to want to have children, have a child in the womb, and or are gonna be breastfeeding or raising it after. Even after breastfeeding, remember a mother has a lifelong commitment, even especially till adult age, to raise the child, is needs to rest enough and grow new cells, have enough nutritious food, a safe place to live while rested for almost 20 years. When their child going to take into school, elementary, high to university, college level, approximately till adult, it is the parent's mother obligation to care for the health of the child. And the children have rights at every age, by law, under God assessed, to have their health and life respected by their mother, their father, potential parents, caregivers, foster parents, medical staff, all of them. Can never be prescribed any dangerous antipsychotics. They harm the brain, and especially if human has a brain damage already or health concern, they do not help the brain, they harm it more different ways. Are never a cure, in the long run harm the brain more and body in million ways and require most blood testing to see whether physical health and is human. Have blood overdrawn, a wound is dangerous to venipuncture, to have a wound in arm, especially a mother or baby, and then blood has to grow there, platelets for the wound to heal in a vein and skin. Is an injury into the vein through the skin. A human might not heal properly there, bruises or in pain. A baby doesn't need to go through this to be tested, monitored for side effects. A toddler, anyone through the years, if a mother potentially went through this, so best to avoid this, be educated, to listen to this, inform all million people. Religious or not, have a right to know. You to think of you want your health proper, If you know someone you will do is recorded in humans, what they do on Earth by choice, not forced to do, not expecting a reward, but the human gift of virtues in them, record gifts of the spirit, religious or not. When humans choose to help someone, to mercifully to help them from the kindness, compassion, or virtues within them, to educate themselves what I'm speaking, to listen to these words, write it down, share this video, easier to listen to, correct any misinformation online, remove these terms, get rid of any harmful antipsychotics from market, whoever is more educated or can. Simple humans right to file complaints to departments. They have to act in best interest of humans, patients, mothers, children. Tell them to prevent as a preventive measure any more humans suffering what I suffered. No one should for 20 years. If they did their job, I wouldn't suffer, would have children. Be happy, live my life, do my medical research. They illegally harm my brain. I don't want anyone to suffer. My body suffered. No disability money, not enough. No medical negligence lawyers. The college didn't even give money. Put asset rights didn't have the heart to reply about that. To respect, find links for shelters, for housing for me. Or they by law, but I can't afford a lawyer obviously because I don't money from what they did to me. This cannot be going on. So I'm mentioning this to prevent mothers, children, humans who want to have children, and from suffering all of this. As I stated, millions and children, humans, some even are acting. Please be careful. Even patient stories online people made. Some are hired actors. Heartless. He's saying schizophrenia different are fake information online. Is deemed misinformation. Not allowed is not correct. Not allowed to be shared to anyone, needs to be got rid of online. People to act, get rid of it. People won't be misinformed, commenting, supporting these people when they're misinforming people. And the people, patient lives are suffering. But human brains, minds, humans are damaged for life. Is not a second, is a long life of memory damage. Human can't remember the mother, the children's name, pet's name, loved ones, what they learned, recent history of what in their life they did. Cannot remember anything. 100 million second cannot work. Clozapine already humans have driver's license taken away, child work hard to learn for. And all antipsychotics are taken away because it impairs the brain. Human has past exhaustion, over sedated, different side effects, ill and cannot function to do a job. So this is already to avoid, and so children don't live through this, have become ill and cannot have a job. Consider they have a life. Mother harmed brain doesn't want to harm the baby. The baby might become harmed and be ill and not be able to play. Have a harm damaged brain, can't think properly. Heart damage, cannot function properly for life. How is it gonna live for life and get a job? It is no one has the right to harm the mother, misinform the medical staff, the father, the baby. They all have rights or valuable lives with proper their health to be treated, assessed by medical staff, nursing staff, all not to be trusted. A lot of them study and care to help human health. As I've seen, it is long studies, not easy. It's a competitive field. Spend $1 million for studies and then don't help anyone. Even medical admission staff, hospitals. There's one or two that care, the rest taking their time and wrongly going along with doctors' medic assessment, wrong ones. Cannot do misinforming people and go on make their paycheck by law under God. Can't. And if people complain, and then they will get rid of these humans, hire those that care, and everyone will be assessed and have happy, healthy people. A lot, 100 million of them in the world. Please share this video to humans have rights to know this information. That no one, unfortunately, have taken the time over years, even medical caring staff, to make a video or even go out online to check how other sites if they have proper information about these terms that are I deem is true if human thinks of it are fake words. They are not real mental health, real brain part concern health disorders. They have no symptoms stated with it. Have to be got rid of online and deemed misinformation, but I need humans to help act to get rid of these. And then the babies' lives will be healthier. All human lives, human that want to have children, will have a healthy baby. They won't have antipsychotics they never need. Will not be misinformed. Those misinforming people can't will have misinformation taken offline. No one will be misinformed ever again. People put more sites to see this one. It is simple. Some people already have the money, have nothing to do, so take the time, educate, and make a little website, put it online, put to the main sites, World Health Organization, put it on the news. People and a million viewers will see, have rights to know which terms to avoid, which doctors to avoid, potentially what I said. If they're saying these terms, then avoid them. They're not real doctors, they're working there but cannot make their pay. I mean, psychiatrist, any nurse mentioning schizophrenia, tell them it is not a real word. You can't misdiagnose with a doctor, I mean, misdiagnose me with, don't go along with it. You can't make your job if you go along with it. File complaints, tell them this is true. They studied the years, they know inside out what is a medical real term, what is not. They know what a medical disorder is of a brain, real part of a brain, each has a name. Body organs have each name. They know already basic for years research. Humans know what each part of the organs are made from, which certain, but yes, from little vitamins to minerals broken down, put into molecules to make the cells. Every organ is made from different little molecules built on from then made from amino acids, from proteins. Every little cell both together makes other little cells and then organs. All medical staff study this inside out, even to basic high school, university, college, and specialized college, university for certain medical doctor studies. Colleges, surgeons, specialists, researchers know these inside out. It is your health that is important. If you want to have a child, consider this. Don't ever take any antipsychotics. Look into it, be early educated if you need a small amount of it, but if it's not going to affect the certain, if you have a certain part of the brain is not going to help your brain, then don't take it. They harm the brain are chemicals. There are certain, you can ask doctors to look into online research, others look online up to date research that other doctors might miss for those more educated. Inform yourself as long as needed as possibly can, proper for your health though. You have rights, take your time, educate properly yourself, ask other even groups, people, victims of different things will say this is what the side effects are. You don't take this one or this one helped me a little bit, you might consider it if you really need it. But if you're gonna have a baby, maybe not. There are victims of different things in the world and humans that even live through certain ones by choice and cared enough more than doctors to put online what the side effects really are, what they actually live through. Heart problems, nausea, vomiting. Humans throw up because it affects the brain certain way. A chemical and antipsychotics. Humans drooling when they sleep. Too much when they're knocked out, have too much of this, say, clozapine for 12 hours. Need more nutritious food in the morning, not given. Have to be given mental wards. Illegally mistreated these people. So it's best to avoid all of this in the first place and to have then a healthy life and then children and inform others. Take the time and you will save others and think of other like myself would been informed and other people will know. Then to have they want to have children, women especially, fathers go be healthy too. Right to be informed, put make your own little video site. Those that have blogs, medical one doctors, put this and have more and even information specific. Take the time, help me put those, get rid of the misinformation that you know, sites how to do. Some humans know how to deal with these sites more than I do. Takes a second, it'll be taken down, corrected with the exact terminology doctors already know these days, deemed credible, true, up to the best of human scientific, say medical reasoning ability of a credible doctor, and recent and past years looked into most recent research done in the world. The best definition true for different mental health disorders, what the proper actual treatments are for that part of the brain, that part of the body the brain affects. Humans have a mood effect. There's different terms. There's no specific, even online. Human care enough to best of reasoning ability put one simple site informing for mental health patients, especially what the terms, what the mind means, what the mood means. Humans affect different parts of the brain, emotion, to say exactly what it is, care for the patients, inform them what those studied, and use this information. They have right to know. Someone please do this. If doctor, take a few seconds. Sites are easy to make. Put type the information. Some even could even already online the proper one that's best recent research done. Put it online. Millions will view. Click on it on a main site, inform the main World Health Organization, another FDA to do right, and people will view and right to be informed, have patient human rights, have valuable lives, their brain health, and will be saved. Pregnant mothers, mothers breastfeeding, lactating, have rights to know this information. The fathers, potential fathers, mothers of children, humans have rights to have their own children healthy, born, taken care of after, assessed properly medically by medical staff, psychiatrists, the nurses, pharmacists. Pharmacists, go on what a doctor prescribes, so make sure first what the doctor said is proper. Don't trust any medical staff if you don't think that they're not gonna care for your health enough. File complaint and find you have rights to find, especially children, as well to find a caring doctor that will help your health. You have rights to tell the truth. Your health is more important than any doctor saying what they're saying. If you know it to be true, you have a health concern, they don't treat you fairly, then file complaint, charges if needed, depending what they did. There are patient rights advisors, but these are humans working there. But even to avoid getting in the situation in first place, there are laws that need to be changed. Humans wrongly assessed and put in work till medically and properly assessed another time for 3 days, and can't even patient rights advisor get out unless they have a medical lawyer separately. Human to get them out. People not given enough food, so mothers, potential, and fathers stay away from any potential emergency room, especially for mental health purposes unless needed. Care for your own health, baby's health. I'm warning you what I lived through. No human should, against free will, and I'm educated. Others are not, so I'm informing you, educating you what to avoid potentially as a normal human on earth. From the kindness of my own heart, soul, so no one else suffers, especially not parents, pregnant women. I don't want to see this online, so please help me. If a human is has tears come to their eyes, see how these doctors and sites, even with all these after years, no one cared enough to take down and change these definitions. Get rid of schizophrenia, psychosis, mania, and other general terms, even stating that these are not real mental health specific brain part disorders. Physical health affecting these have no real symptoms stated. They're, in essence, fake words. Humans can be admitted to certain words don't know because of a fake word, and then misdiagnosed that way, and then given clozapine for something that didn't do with schizophrenia, psychosis, or mania, a fake word. But millions have and are still in the world mistreated this way, illegally misdiagnosed. But with having a fake term and children, parents suffer. Side effects don't need brain damage, not a disability when disabled million days can work beyond their control, and no enough money, no not funded for medical negligence lawyers, and live on street disabled and die out. Suffering don't deserve. So, and children don't deserve this in the womb. Breastfeeding mothers to take care to inform themselves, avoid all antipsychotics, avoid all staff mentioning fake terms that I stated, schizophrenia, psychosis, mania. Help get rid of these terms online immediately. There's even few domain sites people view won't see it ever again online. Tell them what happened, there's few sentences that is a fake term. Slow down and really think. Even humans not educated can figure out this is true. Don't have to be medical doctors. It is not a real brain physical health concern with simple actually side effects stated. I mean symptoms, it's a difference. So this is a fake term. It is no real definition to it. So don't think of it. Get rid of it online as misinformation. Put it there online. More people will show you in video doctors this, and people will see this true and avoid it and have a healthier life. Healthy babies, happy families. When healthy, they're happy too. No brain damage ever. No long lasting side effects damage the brain of an infant, a mother. No more ECT, harming a baby in the womb and mother electrocute alive. Whoever, please fix these sites. Mayo Clinic, still well known in states, has misinformation online. ECT, electroconvulsive, even termed therapy. This is not therapy to help health. Is an illegal when don't choose is torture, bodily harm against freedom of choice. So don't trust any sites. Even remember, slow down, think of it. If it's gonna benefit your health and a woman, mother with a womb have a child in the womb rather and breastfeeding and have to raise the child after to be healthy before and all the time after. Don't take any medication. Most are chemicals to do something. Think of that way. Antipsychotics are mostly all harmful. Brain and body health absorbed into blood and then to baby and breast milk. So don't take any of them. They never help you or the baby. The father, they never help. Harm human life. Brain damage cause for life. Body health need blood testing. Weak with no blood can't do anything. Baby then be disabled cannot do anything to play. Learn easily will be have brain problems. It is not worth taking antipsychotic ever. The dangerous ones. I don't know if there's actually any antipsychotic that's deemed actually beneficial. I didn't see. I'm not a psychiatrist. I studied for years, but if I take the have time and can easily tell another humans to help do the. I only know the ones I actually know that I lived through side effects of, which are all harmful. And educated enough that they know that and looked into, took the time to know that this doesn't affect these parts of the brain. What there might be intended actually for the chemicals are very harmful in clozapine, olanzapine, risperidone, polyperidone, loxapine, this and then benzodiazepines, Abilify is aripiprazole. They have other names for each of one of these. These are very harmful to the brain, physical health, and have long, million-second, lifelong lasting most effects of harm on brain, memory, thinking ability. Most oversedate someone too tired, can't even function, can't do jobs, have license, driver's license taken away. So if you want to have a child and drive a car to drive it to warm, nice, safe places, then don't take antipsychotics ever. Because you're going to have your driver's license taken away. And you will be ill and cannot have a child and have a happy life with child. And a father to consider too, driver's license taken away, might not be able to drive a child somewhere that needs it. In Canada, states is mostly cold. Humans need driver's license, work hard to learn it, so avoid it. Don't take any antipsychotics, especially harmful ones I mentioned, and there's many others, hundreds, are chemicals and have to be got rid of by FDA. There's 100 years of research stating clearly prove humans victim like myself that these were never allowed to be given to humans and are not allowed to be produced or sold. These are never treatment beneficial to brain, mental, or physical health. are never cures and harm in the long run more than they cause any good, especially in humans that don't need them, and especially in humans that have a different brain mental concern and they're not actually treating any of them. They're harming more parts of the brain. And a human has health failing many ways of side effects that don't even treat what is actually need to be treated. The brain specific health concern is not treated, left unattended to, and the doctors misdiagnose, prescribe wrongly these antipsychotics that harm the rest of the brain body, and the human is suffering more ways than is actually supposed to be treated, and relieve their brain from suffering mental health disorder, health concern, and physicality when taken given antipsychotics. And against free will choice, as stated, human doesn't choose, is illegal, and cannot be given by doctor, psychiatrist, any antipsychotics, benzodiazepines, any medication a human doesn't consent, choose to verbally doesn't say I want this, I choose to take this. If they don't say I choose to take it, even babies in womb have rights. Free will of choice, given by God, religious or not. The mother has to act in best interest of the child till is enough age rather to think for itself, knows to accept or not. But in essence, all antipsychotics are deemed harmful and not beneficial to the baby in the womb and after, while mother breastfeeding and rest of life. And benzodiazepines and other ones, they're different classes of relieving anxiety. Benzodiazepines, some do, or are stated to do rather, but don't. And two, even depression is treated mostly by counseling humans to have a happy life, proper well being maintained. So ECT doesn't help any depression, causes more over time and brain damage. Human is more depressed and cannot function work and is poor, disabled, with not in this world with not enough disability, money, assistance in Ontario for sure. Lawyers they can afford and live on the street disabled and are more disabled and cannot work and have no family, can't, and children. They have their driver's license taken away and leads to more depression. Depression only it can be is more counseling to be recommended by the psychiatrist first or doctor, other caring staff, human to have enough vitamin D from the sun, healthy, enough vitamins, potassium, but there's other ones that help the brain be complex. Omega 3s from food, healthy diet, exercise, and a happy life. That's what helps depression, unless further assistance, maybe natural supplements, can be scanned deemed by a real brain specialist. But most are misdiagnosed and unfortunately, but I know true, looked up the actual parts of the brain. The ECT does not help depression, is very harmful in every way, needs to be get rid of from the world. I deem it illegal torture. It is not therapy. The term itself is misinformation, electroconvulsive in quotations therapy. This is not therapy, beneficial to health, to a mother for sure in the womb, having child and even breastfeeding after, and to any human alive. Is illegal fasting against free will given, especially misinformed R2. Humans choose to go through this. That is their choice, but are most misinformed and suffer lifelong memory and damage and don't function and are poor, disabled, lead to have no money, funding, and die out on the street freezing. And mothers and babies don't deserve this, and all humans. I know I am homeless myself because of them. Not enough funding, even shelter from food after they disrespected colleges that hired and looked into a human victim. I don't for over a year and a half could easily fire the staff and my respect my human life and dignity a woman. Give me funding for housing up to help disability links. Find medical negligence lawyer funded for me when they did wrong to hire that, but didn't. and millions in this situation. I am choosing to use this information to inform people to care and by word of mouth as about careful COVID times easier online. Clean up the misinformation, helps medically credible staff. You know the exact definition these days. If it looks, you can tell right away. Get rid of the sites you know how to do. Contact me if you can, but you know how to do this. I don't have all the resources, would make the calls myself. And to remove this misinformation online immediately, and million viewers still tuning in, mental health a big concern in the world. We will not be misinformed. People will have right information right away, not see the wrong one's terms, and seek better medical advice and counseling, nutrition counseling, most what they need. Unless I have a serious brain damage disorder, need to be recommended cared for, refer to a brain specialist. A certain specialist geared to what their brain physical health concern actually is, a specific part of the brain. Whether it controls a certain physiological function that is affected. And to be assessed, there are medical and non invasive scans for brains. Human have to consent to this, but can further see what part of the brain is affected. And by choice for adults, though, children too, but they are young, so be careful. But it is best to be healthy first. Avoid all anything the medication that may be chemicals. Try a naturopathic route of safe vitamins. Food first. Healthy green leafy vegetables have vitamins, minerals. Whole grain. Don't eat white pasta, flour, foods, bread. They have seeds, nuts have more nutrition, proteins help the brain body have more energy throughout the day. Don't eat chips. Even with omega 3 fatty acids from fish, and even some supplements throughout the day help the brain and heart. B complex foods rich in B vitamins help the brain metabolism. Human is overall healthier in many ways. Potassium for the heart. Avocados help human heart is healthy fat in the body. Has enough potassium. This studies people to see online, even make videos, but it helps the brain, vitamin D in the heart. And say even turkey tryptophan has and helps make serotonin in the brain messenger to help human brain and physicality be healthier and happier. That in itself is a huge makes a human a lot healthier and happier. Humans to consider a natural route of counseling from a nice medical doctor, even and counselors in the world might benefit more than a negligent dealing with a negligent psychiatrist, medical doctor, GPs. Be careful. There are a lot of people there do care, assess medical health properly, and know they can make a paycheck and if they're gonna harm health. But there are many medically negligent staff. Don't even some that care but don't do entirely their job. Some making paychecks can't, and humans needlessly suffered, especially children. And human like myself can't have children, is lifelong. Human C would be happy to have and raise a child and care and can't because it had side effects and I didn't need. I intelligently fought against, but many people are not educated in medical terms and still have rights to know this information. So please put it online, this video, take care of it, share it free to the world, to any human that needs it, medical sites, inform them, put to medical anyone has any other thoughts, put it to medical schools, to psychiatry wards, to someone please clean up the previous CAMH in Toronto, Temerty, there's a ECT clinic in Australia one. There's medical staff, 10 of them going along, secretaries with illegally and misinforming people and online promoting this ECT. Get rid of ECT entirely. Doesn't help anyone. To make the FDA get rid of it. Save the health of children, mothers everywhere, fathers. It is worth taking a second out of human life to save 100 million people by simply even removing misinformation online. These terms and people won't see it anymore. Tell them why even. It is a fake word. So don't think about it. Think of what your actual brain health concern is. Find a proper advisor, doctor, psychiatrist if needed. Get a specialist if needed. Avoid psychiatrists unless needed. And care for your health. Respect a baby's life. And if you're going to have one parent's mother, treat them as you want to be treated with respect. And care for your own physical health before. Avoid anything that's chemicals. Educate yourself, and you have to do under God assess, judge continuously. By law, you have to care for the infant while in the womb to avoid dangerous antipsychotics. Listen to as much as needed which ones, find the other ones. If it's iffy information online, consult a doctor. Make sure you're healthy. Don't consider having children if you're on antipsychotics ever. Respect their lives. They might not grow healthy in the womb. They have no one has the right to disrespect another life, child this way. They have a right to be grown healthy, not suffer on growing new organs and then after when taking milk from mother and growing new organs, brain cells, immune system. They right to be healthy, have human rights, free will of choice to respected, human dignity of God within them, and other rights. A live human being with emotions, soul, belong to God, brain, life force. No one gets away with anything on earth are continuously judged. Assess right infants if mistreated by mothers is recorded in the mothers. And when humans eventually, when they die separately, a human is assessed what they did on earth to respect a baby's life, their life, health. Everyone doesn't get away with anything. They are punished if they didn't do morally right to affect everything they could do to a baby, to make sure it's born healthy, to avoid antipsychotics, to avoid ECT, to find the proper medical staff that would care for them, their infant, the father to care for his health before having a baby too. Antipsychotics they might absorb into his bloodstream and sperm negatively affected. Clozapine, these ones actually harm these humans don't even have proper, say a man, the father, they might have erectile dysfunction. There are different side effects of these dangerous antipsychotics might prevent if a human, the man, even from having children, are ill with side effects of blood sugar up and down, different things that it will prevent a human that they don't even need the antipsychotics in any way to help them cause harm in essence antipsychotic clozapine especially million ways and prevent men even want to have children can't lose their license can't have a job because their brain is damaged organs severely too much fat grown blood sugar up and down get diabetes overweight heart problems blood overdrawn over sedated sleep 12 hours and no nutritious food and die out 10 to 15 years sooner that's what clozapine doesn't help anyone and harms the brain more over years and doesn't help treat anything what even if a human was prescribed it for it doesn't treat anything to help any brain physical health at all olanzapine doesn't help is dangerous illegal according to me should not be approved by FDA clozapine olanzapine risperidone polyperidone loxapine and aripiprazole abilify and other ones that I haven't seen, well, if I can, would put online. Is easy even to find certain ones, so please care for your health best you can, and inform everyone else. And please help get rid of the misinformation. As I stated, everything's online. It will be deemed misinformation by the most credible sources of doctors, this, and I am speaking truth. I have a university honors degree from University of Toronto in life sciences and a victim of these side effects, so truth spoken, credible, true information spoken to get rid of these terms. And human, whoever knows these better than I do, doctors, please help. Sites, get rid of them. Make an information help site if you can. Where these are deemed misinformation, help or even let me know which board can fix this or information will be act right away and will be resolved and million people not misinformed anymore. Everyone might have more children in the world, healthy, happy. When breastfeeding, when in the womb, baby happy in the womb, has a heart, soul. The mother loves it enough to care for it and has the right to be respected this way, many rights by law, legally, and under God, respecting one life of another as everyone has a right to be respected, dignity, a valuable life and health, brain, physical, mental health of all time. At all times, humans will inform others, get rid of misinformation, get rid of these fake terms that I stated, these illegal antipsychotics that I deem FDA have to get rid of already for years now, but didn't, cannot make pay if they continue to push these sales, production of them. Pharmaceutical companies illegally push this, have a market huge for this, for these, and patients with clozapine, especially in pharmacies, go along with it, making pay, wrongly harming people. Don't have children because of the side effects. Newcomers misinformed, don't have children, right to do, would love to do, and be healthier, happier, have driver's license to take their children places, but don't. So these antipsychotics, if they got rid of from world, to be got rid of online, information wrong about them, excuse me, by carrying humans to act now, and to save the health and lives of millions of babies, children, parents in the world, prevent them from suffering any mental, brain, physical health concerns in the world. Be a human earth angel, use your gifts, virtues to perform mercy act, to listen to this and help others from the kindness and compassion of your heart and soul, to share this information to millions, translate this video please, to all in the world who need it. They have a right to be informed, never suffer any more ill health anymore, right to have more people healthy and be have children, more babies respect in womb, never needlessly harmed. Get rid of the non-credible doctors, negligent, incompetent ones, especially psychiatrists, once and for all. Look up what psychiatrist means and fix what the job title is actually for. If they're not going to do their job, hire more real, actually caring medical doctors and brain specialists and nutrition staff, which more people need. Get rid of doctor's psychiatry term entirely. Job if needed, and make a different proper specialist if needed. This will benefit all children, babies, unborn and born, parents, humans in the world. It is truth spoken. A kind hearted human, an earth angel, real one, on this earth, acting in the best interest of babies, humanity, all living creatures, animals, and care as well, humans as well, to care, respect of animals, have a life, brain, soul, have mental health concerns too. To be make sure they have proper terms put for these kind-hearted souls. They care for humans. They have the most kind heart of them all, have emotions, free will of choice, and rights to be respected as well, and their health, brain, mental, and physical health to be assessed properly as well. to keep in mind by medical staff, veterinarians, pharmaceutical companies, others, and they have babies too in womb to be taken care of, produce milk, so never to be given dangerous per se. If there's any antipsychotics, I'm not sure of, I didn't study, but might be. Anything harmful to an animal brain is like a human being, but an animal that it doesn't actually have reasoning capability to figure out that it needs a certain medication to help it if needed, not allowed to ever have a dangerous antipsychotic given to it that never helps it. Any medication that is a chemical that will harm it. It has a dignity, valuable life of God is recorded. Other humans cannot mistreat, misdiagnose animals. They have a life, organs, cannot let them suffer by law under God. And they have children, puppies, kittens, bunnies. They have to take care of their parents of little animals, have a life too. That might spread in their bloodstream to the milk to the infants and while in womb. And there's animals of different species, birds, different living creatures, farm animals and wildlife. Humans to find those that take time to look this up if there's any illegal antipsychotics or medications, get it off the market, save animals from suffering. As I stated, they don't have the reasoning ability to think like humans to find proper medical advice. They cannot talk. They only basically know they're suffering something poor already, brain harm or something, injury, I mean, don't know what it is, and need humans to assess it, scan properly, then care for make decisions on their best of their reasoning ability, caring vets or animal brain specialists, organ specialists of different animals rather, and their different species of them to consider. They have different genetic makeup. These are things as well for someone to care if they see any misinformation about this. Put the sentences online, make even little sentence easy, create videos. Say people to view this, tell other doctors with more followers, someone dealing more with animals. Clean up misinformation, fake info, useless general terms online. Put true information, inform people. People need to know this and right to know. And 100 million people and animals will not suffer. You will make them happy. You'll be knowing how that you helped 100 million innocent animals. Loved pets people have, children keep in mind, have pets, loved ones, affects one life, another life. Everyone has the right to be healthy, respected, their brain, physical health, their life by everyone else. When they help clean up misinformation, then these humans are healthier, happier, the animals, nature, everyone will be then happy and healthy and live their heaven on earth as they rightly deserve. Well, they only have one life to live, and everyone, as they know, cannot heal anything. And right to be healthy and informed properly and not misinformed online or anywhere in the world by anyone. Have human rights, a soul, brain, emotions, personality, physicality, health, brain, mental, and physical health, free will of choice, human God given dignity, a valuable life to be respected in on themselves and of all others, children, and all animals and nature, and those in heaven. Thank you for listening. Please subscribe to this Angelica Gikela Earth Angel channel. I have a helpful, very beneficial to all humans Earth Angel Help website on wx.com. Please share this to the world as well. And other sites, very informative and recent videos. And humans to clean up certain misinformation as I stated and other ones. Please act immediately, help a human and an earth angel. I am a victim, all as stated, and please act to help resolve this so I see everyone happy, healthy too, and no one will be a victim and never wronged their health, especially babies, parents, mothers, breastfeeding mothers, anyone that doesn't deserve to be misinformed or mistreated, misdiagnosed in any way. Their health, brain, physical health, and have a right to be treated fairly, healthy, and have their heaven on earth as they rightly deserve. My email is a.jakiela@hotmail.com. If anyone wants to contact me, please do, and higher level boards or anything can think of and help me sites and to get rid of certain real medical pharmaceutical companies workers that aren't working right there can't do their job. FDA ways to get rid of online different sites to inform me how this can be done that knows how to do this, and the more medical ones, PubMed, Wikipedia, other main medical sites. To please help me inform me and to contact others that you know right away. Every second counts. To accomplish this right away once and for all in the world, and misinformation will be gone, and millions will not suffer, and everyone will be happy and healthy. My name is spelled Angelika. My last name is spelled Jakiela. I am a humanitarian, acting in the best interest of humanity, babies, humans of all ages, their health, well-being, nature, animals, and respect all those in heaven and human dignity, rights, and freedom of choice. A human earth angel.